Hello and welcome to our special show. I'm Gargi Rawat. Two COVID waves have helped bring health as the primary focus area for most people. It's important for society to learn the right lessons so that we can take steps to prevent or be better prepared for a future COVID waves. The COVID pandemic had a big impact on health systems around the world. While dealing with COVID, we overlooked the fact that people's lifestyles were also severely disrupted, and as a result, metabolic problems have become more common. It's also important for people with diabetes and heart disease to understand how to better manage their conditions at home. Learning how to control your diabetes, heart disease will save money and time and help you have fewer emergency and hospital visits. Beat diabetes myths and facts will impact and help a large number of people. And today we have with us experts to share with you advice on diabetes and its management. We're joined by Dr. P.S. Shivam, MBBS, C-Diab, MHSC, Consultant Diabetologist, Shriram Diabetic Care, Chennai, and Dr. Sayan Chattaraj, MD Medicine, Consultant Physician, Nehru Memorial Technoglobe Hospital and Health Etc. Polyclinic, Kolkata. Thank you so much, doctors, for joining us on this program. Dr. Chattaraj, due to COVID, many chronic health conditions have been aggravated. Is there a particular, is there something we have to look out for, a particular type of a cardiovascular disease which has been aggravated by COVID?
Actually, COVID-19 has its impact on all the systems in our body, including the cardiovascular system as well. Some patients with previous cardiovascular illnesses or cardiovascular disease, it is seen that during COVID-19 disease, they have more severe disease and increased mortality in comparison to the general population. And apart from that, during COVID-19, we face some new cardiovascular diseases in otherwise normal population. Among them, the very important thing, the COVID-19, what does, it causes a widespread inflammation throughout the body. And as a part of that inflammatory process, we get more number of heart attacks or acute myocardial infarction during COVID-19 illness. And we have the disease of cardiac muscles, that is cardiomyopathy. There is viral cardiomyopathy that is quite common, and it can lead to patient's death apart from the COVID-19 pneumonia. And apart from that, that cardiomyopathy can lead to abnormal heart rhythm, that is arrhythmias, and some of them can be fatal as well. In a way, cardiovascular diseases, pre-existing diseases and new diseases both are more in COVID-19 population.
Dr. Shivam, we have learned many things due to this pandemic. The importance of immunity is one of them. How does immunity vary in people with diabetes?
In normal people, there are two types of diabetes. One is the adaptive arm and other is the innate arm. So the initial innate arm is okay in diabetic patients, but the adaptive immunity, what happens is the dendritic cells, the monocytes, the lymphocytes, the neutrophils, and all other initial fighting soldiers, these are blunted in diabetic patients. During COVID, what happens is when the virus comes in and tries to replicate, these fighter cells have to fight back, and that doesn't happen initially, and the viral replication rate goes on exponentially. At this point of time, the virus takes a cytokine route and stimulates the cytokine so that the patient develops a cytokine storm. And what happens is cytokines generally kills all the predominant parenchymal cells in the lungs or any other organ tissues, including myocardium, renal cells, and neuronal cells. So the actual immunity is antibody related, and the antibody related immunity route is been blunted, and cytokine route is selected during COVID-19, and this leads to ARDS and premature mortality and death rates are very high among the hospitalized patients.
Now, Dr. Chattaraj, COVID lockdowns has seen, people being under a lot of physical and mental stress, and this has also seen cases of blood pressure rising. And does this kind of stress-induced blood pressure then settle on its own, or does this then require long-term medication?
Actually, stress has its part in blood pressure regulation and rising blood pressure. So those who already have hypertension or high blood pressure, their medicines might need some modification during this stress period. Apart from that, those who previously didn't have hypertension and developed new onset hypertension, they might need new medicines for that. But the stress related hypertension might require medicine, but the primary thing that has to be taken care of, that is the stress. And for the stress reduction, we would suggest some lifestyle modification, uh, like having adequate sleep, having proper nutritious food, and actually that is very important, how people cope up to stress. Some people resort to some activities to curb out stress that is not actually healthy, like smoking, taking alcohol, or engaging in some activities that actually increases stress. So we'd suggest that lifestyle modification, and apart from that, if required, some medications that eventually may not be required in some patients, but some patients might require long-term antihypertensive medications.
All right. Now, Dr. Shivam, as we all know, diet plays a very important role in managing diabetes. If you could just tell us more about that and what type of diet should one with diabetes really take?
Yes, diet plays a very critical role in diabetes. Already we have instructed patients to take a carbohydrate restricted diet. The carbohydrates are divided into two. One are monosaccharides, another is polysaccharides. Monosaccharides have a rapid blood glucose absorption, and the polysaccharides have a very delayed glucose absorption. Mainly, monosaccharides constitutes white rice, white sugars, pastas, all the sugar-rich items, and the polysaccharides which constitutes the vegetables, low sugar fruits, etc. In diabetic patients during COVID-19 era and from the work from home culture, their exercise activity has dramatically decreased, and many of them have become sedentary with lack of sleep and obesity. They need to stick on to carbohydrate restricted diet. Especially, they have to stay away from junk foods, especially the pastas, the maida-based diets, the sugar-rich diets, etc. At the same time, they have to increase their protein intake. They have to, that is, the one fourth of the plate should contain protein, half a plate should contain vegetables, and only 1/4 of the eating plate should contain polysaccharide complex carbohydrates. And with this diet pattern, the sugar levels tends to keep at an optimal level, and they should also seek that they take a low to moderate glucose index diet.
All right, Dr. Chattaraj, for people with high blood pressure, are the different types of salt available in the market, like low sodium salt, rock salt, advisable for them, or should they focus on reducing the quantity of regular salt in their diet?
Yeah, actually, salt or sodium, the salt and the salt contain the sodium content, that is directly related to hypertension and cardiovascular mortality. So the sodium content of a salt definitely has its impact on hypertension and mortality. So low salt or rock salt, that is salts rich in potassium, hmm, is definitely helpful. They are helpful, but we have to keep in mind that the daily intake of salt has to be reduced, be it in any form, that is table salt or otherwise. So as WHO has recommended a daily salt intake of less than 2 gram, and American Heart Association's recommendation is even lower. It's 1.5 gram a day. But actually, on an average, in our country, an individual consumes about 9 to 12 grams of salt. So that has to be reduced. And the salt in any form in excess is harmful. But the low sodium salt has some impact, but the total salt intake has to be reduced, and the potassium rich salts like rock salt is definitely helpful because foods rich in potassium is actually cardioprotective, and except some in some instances or some cases like the patients with chronic kidney disease, this high potassium or potassium rich diet is recommended. So the take home message will be less salt, and if required you can switch to low sodium salt or rock salt. That is healthy, but overall salt use has to be reduced.
All right. Well, thank you for that. We'll slip into a short break now and return on this very, very special program where we're discussing health and diabetes. Do stay with us. Welcome back to our special show. We're discussing health and diabetes, and we have a panel of doctors to talk about it. Now, Dr. Shivam, the widespread fear and helplessness and death, also economic hardship that was caused by the pandemic has also resulted in increased stress levels. Has this stress impacted diabetes management?
It's true that the stress levels have risen to a great level in this COVID-19 pandemic. During stress, biologically, the brain releases a lot of stress hormones inside the system, notably the adrenaline and the cortisol. So these hormones actually increases the blood glucose even without the patient eating carbohydrate-rich food or even with adequate exercise also. The liver starts producing a lot of glucose and pumps all this blood into the bloodstream, which is called as the hepatic glucose output. So the number of times a person gets stressed up in a given day, the number of blood glucose fluctuations are also given, which is what is called as glycemic variability. So we ask the patients to stick on to regular physical activity, which reduces their stress to 40%, and another 40% by going for yoga, meditation, deep breathing exercises. They can go for online yoga classes. As it is in the COVID era, many of these meditation yoga centers have been closed, and these people can safely go for online classes of meditation and yoga or any other safe relaxation technique without going into indulgence into alcohol and smoking. And these people can also have a very good peace of mind even with 8 hours of sleep in a given day.
All right, Dr. Chattaraj, how do we stay active when we're in self-isolation or in quarantine? How does one, stay active then?
With the each waves of COVID-19, we have many people in quarantine or in home isolation, and with the vaccines around, we will see more people with COVID-19 at home rather than in hospital. So this is very important to stay active. Actually, in being active will boost immunity, and that will help the person fight the disease better. Most of the COVID patients, those who are otherwise physically normal, those don't have any major heart diseases or so. So we'd recommend doing aerobic exercises and yogas at home. That will release the stress and also keep them physically fit. As well as in young populations, we can recommend other forms of exercises like dancing to music even, and we have some good online classes, online exercise classes and schedules that they can follow. So being active is a very important thing during the lockdown period or during the home isolation or quarantine period. So we can modify our exercise schedule. We should try to remain active as well as much as possible. So that will help the person to fight the disease, and the person their cardiovascular health will also improve.
Now, Dr. Shivam, how does diabetes present itself in adolescent children and what is the MODY?
Yes, a very good question. Type 2 diabetes is what's also called as insulin-dependent diabetes mellitus, which happens in elderly. Of late, we see these sort of condition happening in children also, especially in age group of 10 years to 15 to 20 years, which happens because of childhood obesity, landing up in heightened insulin resistance and insulinopenia later on, followed up with diabetes. What happens in other conditions in children is type 1 diabetes, which is juvenile onset diabetes, wherein the pancreatic beta cells are completely exhausted in these children, whereas in type 2 it is 50% exhausted and the rest of the 50% is functional. The other condition, the MODY, is called as maturity onset diabetes of the young. Now, this happens in the monogenic form, and what happens in MODY is it occurs in children between 15 to 25 years of age. Whatever may be the type of diabetes, it can be managed effectively when the parents are very attentive and observational in their homes, watching these children, and taking a cue from the observation. They need to get treated promptly at the earliest.
All right. Now, Dr. Chattaraj, also are people living with the heart disease more vulnerable to severe complications from infectious diseases?
Yeah, certainly. The people living with heart disease or those who have previous heart disease, they are actually more prone to develop COVID-19 infections and its complications. And it has been seen in different studies that the people who has heart disease, the mortality or COVID-19 infection or any infections per se is more. As in COVID, the mortality in normal population is around 6%, whereas the people with cardiovascular disease, they have a higher mortality, around 10.5%. So it is actually dependent on multiple factors. As COVID-19 is a disease with predominant inflammation. So this inflammatory process will lead to cardiovascular diseases like myocardial infarction, myocarditis, different kind of arrhythmias or abnormal heart rhythm, and lastly, the thromboembolic manifestation, that is the blood clotting and its consequences. So overall, the mortality and the morbidity is definitely much more in patients with heart disease.
All right. So important for everyone, to keep themselves healthy in this time. Thank you so much, Dr. Shivam and Dr. Chattaraj, for joining us on this program on how to maintain your health and also manage your diabetes. Thanks for watching. Goodbye.